The calcium is actually part of the healing process. When we develop deposits of cholesterol in the wall of the artery, one of the body's natural defense mechanisms is to put down calcium to try to heal this sort of bubble. So in and of itself, it doesn't cause the disease. What it does, though, is it doesn't occur there unless there is plaque there. You could have all the risk factors and not have any coronary disease. You could have none of the risk factors and have coronary disease. But if you have a coronary scan and you see calcium, you know you have disease. It's not a risk factor. It is looking at the disease, part of the disease process. Very exciting, very exciting.
You know, the #1 killer today is heart, and #1 killer in 1940 was tuberculosis. And that was completely eliminated by X-ray screening of the chest, the famous chest film. So to me, being a poor physicist, it was the same. Let's get rid of heart disease because heart attacks are completely preventable. So let's find out who is on the road to having a heart attack, screen them, and eliminate it.
The new technique can pick out the patients that conventional risk analysis cannot. Thin, fit, and outwardly healthy, and that's a lot of people. In the 4 years after coronary artery scanning is invented, over 500,000 people die of a heart attack with absolutely no warning.
Breathe in. Hold your breath.
The scores go 0. It can go as high as 4,000 or 5,000. So I call it mild, 0, mild, moderate, extensive, and oh my God.
Breathe in. Hold your breath.
0 is the best I can do for you. 1 to 100 is called mild. 101 to 399 or 400 is considered moderate. 400 to 1,000 is considered extensive. And above 1,000 is in the oh my God category. Every time we tried to redo the experiments, we got the same answers. It was just remarkable. The more plaque you had, the more your risk was going to be. It was independent of your cholesterol, independent of your smoking history, independent of virtually anything. It was the most powerful predictor of risk.
Look, what are your alternatives? You say to a person, well, you're at low risk, and then if the patient dies, oh, I was wrong, sorry. Why guess? Why base your decision on a score derived from a compilation of risk factors when you can look directly at the heart and see how much plaque there is there?
As the unexpected deaths pile up, the way forward seems clear in the battle of the stent and the scan. The scan helps prevent heart attacks and costs only a few $100. The stent is risky, expensive at tens of thousands of dollars, and the patient has to either have or be on the brink of having a heart attack. But that analysis neglects the profit motive.
During the late 1990s, the Mayo Clinic was reporting about 50% of its coronary angiograms were normal. That's equivalent to saying unnecessary. The Mayo Clinic is still a major research center with excellent researchers, the best in the world. And Mayo Clinic had done some research studies showing that coronary calcium could predict who needs a coronary angiogram and who doesn't. So the researchers said, well, we have this test with almost 100% accuracy for predicting who should have an angiogram and who shouldn't. Why don't we offer this to our patients? And the administration shut it down because the cath lab generates 25% of the revenue of the Mayo Clinic, and that would have been cut in half if they started not doing unnecessary angiograms.
More women die of heart disease than men in the States every year since 1983. So it's a huge problem among women. 5 times as many women die of heart attack as breast cancer, yet very few women have any knowledge of that or any inkling of concern about heart disease compared to breast cancer. So when we talk about the mammogram of the heart, that's at least 5 times more important to women than the mammogram of the breast.
With heart deaths stubbornly high, and stent overuse discredited, you'd think the mammogram of the heart would be on its way back, but you'd be wrong.
So we are going to put a stent there now. Okay, give me a 2.25.
There's one last key opponent, the insurance industry. They won't pay for the test. Ironically, the headquarters of giant health insurer Kaiser Permanente are just across the bay from the offices where the very first scanners are installed. In the early 1980s, the Kaiser board come calling.
We met with the Kaiser executives. Of course, most of them came in to be scanned. And some of the Kaiser researchers did some excellent research on coronary calcium screening, published research.
But that didn't mean they'd pay out for their policyholders to have one.
They said, we're not interested because our typical patients are only in the plan for 5 years or less. And this is a long-term cost savings. So the cost savings will go to our competitor. And no need to single out one particular health maintenance organization. All the insurance companies told us basically the same story, that their patients are not long-term holders of that plan. So if they reduce cost over the long term, it means nothing to them. It only goes to their competitor.
We contact the big insurance companies, Kaiser and the rest, to find out why they will still pay for a $50,000 stent, but not unless you're very lucky, a $100 test. But they won't talk. Then one man is brave enough to break the wall of silence. He's been the public face of two of the Big Five as their media spokesman.
I was a journalist, a newspaper reporter for some time, but then I got into public relations work, and I realized toward the end of my career that something had happened to what I was doing for a living, and it just dawned on me that in many cases I was doing the exact opposite of what I was trying to do as a journalist, which was to try to find truth and as best I could report it to do that. It sounds kind of trite, but I did look in the mirror and say, what happened to you? How did this happen to you? The system is not set up to reward prevention. The system is set up so that doctors are well compensated for treating conditions. So are pharmaceutical companies. We mainly have a disease industry in this country.
We've got a healthcare system that's out of control, spending an incredible amount of our national wealth, not making people better. We've developed a system that's based upon putting out the fires, taking people with chronic diseases and doing all these things to them.
There is just not nearly enough attention paid to trying to help keep people from getting sick, from getting congestive heart failure, from getting the kinds of illnesses that require stents and being put on maintenance drugs and having expensive care for the rest of their lives. They don't want them to die, but they don't necessarily want them to get better.
Well, that's where the money is. It's like the Willie Sutton law.
It's Sutton's law. When asked Willie Sutton, why do we rob banks? He said, that's where the money is. So the insurance companies are following Sutton's law.
You don't get to be CEO of a company because you've saved lives.